We are extremely grateful to have Dr. Sarah Lidstone speaking with us today. Dr. Lidstone is the director and research lead of the Integrated Movement Disorder Program, a collaboration between the Morton and Gloria Schulman Movement Disorder Clinic at Toronto Western and Toronto Rehabilitation Institute. She is also a movement disorder specialist in the Edmund J. Saffer program in Parkinson's disease. Dr. Lidstone has translated her research examining models of care into the development of the Integrated Movement Disorders program, which uses a patient-centered approach to focus on the integration of mental health and physiotherapy. Through her innovative clinic model, Dr. Lidstone seeks to redefine the rehabilitation experience involved in multidisciplinary care and treatments. So please join me in welcoming Dr. Lidstone.
Thank you again very much for this invitation. I love being part of this group and talking about this, my favorite topic, which is how we can make care better for more patients with Parkinson's. And I'm actually really happy the order got shuffled a little bit because I'm glad to be going after Sonia. I've come to get to know Sonia quite well, working with her on our patient advisory board. And so this talk I've prepared is kind of zooming in on one aspect of our program in Toronto that really is about that next step. So once we come together with our patient advocates, how does the work then look? What do we do with that work? And what can we actually accomplish and achieve together? So this talk is less about kind of a bird's eye view of our program, although at other points I'm more than happy to discuss this anytime with any of you. This is about what it looks like on the ground to actually work with our patient partners and devise programs and therapies, and how it changes how we look at Parkinson's. And so I hope you enjoy this. So my feeling on this is that advocacy actually is partnership. And this is crucial if we really actually want to create impact. And by impact, I'm talking about quality of life. I'm talking about satisfaction. I'm talking about clinical outcomes now, not in 5 years, not in 10 years, but impact now. And this partnership can occur at multiple levels. So in our program in Toronto, we're focusing on partnering both at the actual individual patient level, where our integrated team is working with the patient as a team in real time, not in a carousel model, but actually integrating at the person level and disease level, all the way up to the system nationally. And so we actually have our hands in a lot of different pots along this trajectory, and I'm going to share some of those things with you now. And also I wanted to just point out that advocacy and this partnership takes different forms in chronic disease, right? We work with our patients for their entire lifetime. And so this can be between the patient, their care partners, and the healthcare team. This can be between the person with PD or their care partners in the community, or between the healthcare team and the community. So there's all different ways that these can look. And what I've learned in the last couple of years doing this work in Toronto is that the more you start to partner, these partnerships to kind of take on a life of their own. And really, this is where really cool things start to happen. So this is just a snapshot to give you some context about how we built our program. We essentially have built an entirely new integrated program from the ground up starting 2 years ago. And so, we are the Integrated Movement Disorders Program. That's what we're called. We live in the Toronto Rehab Institute, which is a rehab hospital network in Toronto. And you can kind of think about it, we're affiliated obviously with the Toronto Western Hospital Movement Disorders Clinic, but we're also kind of an offshoot of them. We do very different work there. And the pillars of the program are kind of our clinical team, the work we're doing, our patient advisory board, which are shown here in this little zoomed in screenshot, which you'll see in more detail in a minute. And also we have a business advisory board of business leaders in Toronto who are advising us on how we can take a business approach to this clinic to scale and spread. So we're actually approaching it more like a startup. And the idea is that this will give the program legs. This will ensure sustainability over time, and think about things like funding strategy so that it can grow out over the next 5 to 10 years and even longer than that. So our patient advisory board began in around September of 2 years ago, and almost years ago now. And it's made of 8 patients, 3 care partners, 4 faculty members, and our team who work together. And we subdivided this large group of people into 3 committees. So one focusing on clinical care, one on research, and one on education and website and communications. We have bi-monthly meetings. And so, developing this board literally from the ground up has been a really rewarding, interesting experience. We've actually just recently written a paper together on this 5-step roadmap as to how you actually execute this. And there's tons of learning in there that I can share at a different time. But just to say that the establishment of this board has meant that we now have a active live conduit to filter and run all the decisions we are making as a group in the hospital through to see, okay, is this important to patients? Does this matter to patients? What are the patient's priorities? And we now have this entirely different lens on the work that we're doing, which in and of itself really broadens the horizons and adds a whole bunch of new different options of what we can do as a team, right? So there are these levels I mentioned before. So all of these things I'm going to be talking about are informed strongly by this perspective that's now been added to our work. So in terms of the person level, this involves redefining Parkinson's as a rehabable condition. Like, yes, there is neurodegeneration that is occurring, but we know that rehab works. There's excellent techniques and evidence around physiotherapy, mental health care, and it's about getting those treatments to the patients early in a way that can then change the entire trajectory of the disease. And this involves self-management. This involves rehab-based treatments. And Angelo did a beautiful job of talking about this in his opening lecture to us today. In terms of our local clinic environment, we've created the board itself, I mentioned, a clinic newsletter I'll talk about, and models of care that actually are built in collaboration with our patient partners. What's the patient flow look like through the system? Addressing wait times, addressing the patient experience in a much more meaningful way. So we can actually change the local environment. And this can then also affect the system level. So with that, we're partnering with Parkinson Canada to develop a care finder as an example so that patients and their care partners can very easily locate a local physiotherapist who has training interest in working with Parkinson's. And so these are things that are accelerated just by including and partnering with the patient voice. So as I mentioned earlier, we're looking to redefine disease. And so the patient here, as you can see in this, we're talking a little bit now moving towards whether you want to call it precision rehab, precision medicine, but it's actually taking into account the patient's symptoms in the context of life, right? And their personal story, general health, and so forth. And so this perspective opens up new treatment targets. It creates opportunities for collaboration and innovation. And it really actually enriches the relationship that you can have with patients and persons with Parkinson's and their caregivers in very different ways. And what I've noticed is that the positive impacts really amplify and extend beyond that individual and can benefit many, many, many other people. So Sarah Lidstone, you may know of her if you are following any of the PD advocate groups, but she is a very strong PD advocate. I'm follow her on Twitter. She has really amazing things to say. And this slide I so get and really struck me, and it's such a beautiful visual way of illustrating the problem. And that is that to manage her Parkinson's disease, Sarah Lidstone spends 1 hour in neurological care, which is 2 follow-up appointments with her movement disorder specialist, and 8,765 hours in self-care per year. So what are we doing as a medical community to support patients in this other 9,000 hours per year? And she says that, I'm not saying that I want more time in healthcare. I'm saying that healthcare needs to acknowledge that the work we patients do in self-care and also start working to make use of our observations for their own knowledge. Just imagine what we could achieve if we start working together as equals, but complementary sets of expertise. And I really believe this. There is this whole untapped side of therapy that exists within this space that patients are hungry for and they want support and resources around. So we address that by having these conversations with patients, by learning this from our board. We right away implemented a change. So we created a self-management rehab program that is seven modules. We developed a e-workbook around it, and we piloted one of our first round that ended just last month. And this is kind of a statement that we have as part of our opening module, but we say Parkinson's impacts every part of a person's life, and there are many ways that people can learn to thrive that go beyond medication and doctor's appointments. Our patients ask us over and over again, what can I do now? And we built a course to answer this very question. Okay, so we're creating targeted therapies that are new, are a different angle, but they're addressing the patient's needs. And the impact was obvious. So we had very, very strong positive impact for the participants who did this program and their care partners. And some of the quotes are things like, I like that I became more aware of how little I know. I need to realize that my life with Parkinson's is not just a series of pills. Another person said, after 5 sessions, I'm learning to be aware of my thoughts, emotions, my physical well-being, and my environment. And I'm much more aware of the way things interact, right? So we are taking this integrated approach to and holistic approach to disease that really is resonating with people. Another example is our new newsletter. So in reaction to COVID, where we were hearing from patients all the time that they were feeling isolated, they were feeling alone, it's really, really, really difficult for everybody, but especially if you have a chronic disease like Parkinson's, we built a newsletter around that. So our winter issue was all about connection. And then the theme of our spring issue is all about mental health, because we know that's a big gap in the care in Parkinson's in repeated publications and surveys and what patients are telling us. And then our third issue that just came out this summer is about caregivers. So it's all about the neglected group of caregivers and resources that they can also engage in and learnings around that. And this has been a really robust addition to our clinic program. We are increasing the number of recipients who receive it all of the time. Our open rate is above 80%. And so this is having a huge impact on patients as well. And we came up with it very quickly. This is not things that take 3 or 4 or 5 years to test and implement. We can do this right away. Just an example of how we're missing the mark. So we went on an exercise where we're trying to build a patient-facing library and curating all of the internet resources that are directed for patients. So this is not academic literature. This is actually content created for patients. And we only developed there was only 408 total bookmark sites, which is like completely small in comparison to how much academic literature there is on these same topics that are out there. So in terms of actual content being developed for patients, there's still a huge gap in that area. And just to show kind of an example of this, if we focus on the portion of this content that is dedicated to treatment and management of PD, here's what we saw if you break it down. So allied health is getting kind of a pretty strong piece of the pie, which is very good. But all these other areas, exercise is a huge gap in the care. People are always talking about it. And medication, there's very little information directed for patients on medication, and patients take medication all of the time. And if you then blow up that allied health component, most of it is on speech language pathology, which absolutely very, very important. But we actually have tons of evidence for physiotherapy. And these resources, though, for patients are lacking. So just an example of if we can get it right, if we involve the patient voice earlier in the work that we are doing. And so I'd like to close by just making you aware of a system level example of how we can create impact quickly. And so this is our partnership with our IMDP is partnering with Parkinson Canada to develop a care finder, like I mentioned. So across the nation, any patient with PD ideally can log into a website, enter their postal code, and be able to come up with a list of different allied health and mental health and community programs that know Parkinson's, that want to work with Parkinson's patients, and they can get local expertise in their area. And we're going to be partnering with our patient advocates at every step of the way building this, because we've learned how to do this now. We learn how to engage people correctly at the right stages. And so that is experience, and that can be used to accelerate the process and really get results and make impact. I'm just going to skip through this. So what have I learned? So I've learned through this work that the voice of those living with and caring for disease is required. Actually, it's required if we want to make real, meaningful impact now. And this is where the magic happens. Magic happens when you bring these diverse perspectives together and keep an open mind on your own work, your own processes. And if you can do that, then really the sky is the limit. You can accomplish a lot of things you never thought that you could. And I also just want to say kind of personally that this is, for me, in this work, really it becomes personal because it redefines this traditional doctor-patient relationship to include collaboration, include partnership. And it's a really fulfilling aspect of my work that I really love, that I hope as many people across this country can get engaged in as much as possible. So thank you very much to all these different groups. You know, this is teamwork at the very most purest sense of the team. And this is my final quote, which I love. So thank you.